essas doenças.
I'm down in Brazil right now, and we're participating in an international research project to look at the biochemistry of the body and primarily to decide how effective we can be in terms of preventing diseases, as well as the more effective treatment of disease. And thirdly, which is probably the most important, is that it's relatively inexpensive to prevent disease. And what this means is that in this type of integrative medicine, we can have health care for all people who need it. We have over 600 physicians worldwide been participating in this program for almost 30 years now. Some of the most important outcomes of this research project to date has been able to resolve a number of very important disease processes. For instance, people who have acute anxiety and depression, we know what those mechanisms are today, and we know how to reverse that. Very important. Fibromyalgia would be another typical example. We've defined the chemistry of fibromyalgia. We know what happens in the body. So today, fibromyalgia is not a very difficult disease to treat. But worldwide, it has been a very difficult problem. So it is these types of things. We have more effective treatments for cancer because we know what's happening in the body as a result of malignant processes. Okay. We have more effective treatments for degenerative or infectious diseases, the fungals, the bacteria, and the mycoplasma. The blood imaging allows us to not only look at these organisms, but also estimate what these organisms are doing in the body and what sort of treatments are effective in terms of getting rid of these infectious agents. So what we find is that in all degenerative diseases, okay, the body's chemistry has changed. The body is no longer able to control itself. And so once you get into this area, then you have risk factors for everything from multiple sclerosis to cancer to arthritic conditions. So what the object is, you have to be able to go in and see what is going on in this biological system, go in and correct that, and then you don't end up with a degenerative disease process. Healthy people do not get sick. Sick people get sick. Okay? So if you have a healthy body, your body is able to, you're going to live longer, you're going to have more energy, you're going to look better. If you have a diseased body and the functional imbalances, you're not going to live a very healthy life. You're not going to have the energy that you need to function, and you're not going to live as long as you should. In microscopy, we're looking at 83 different morphologies, and we're correlating that to 146 different stresses and pathologies and disease processes. Okay? There's a basic axiom: you can't control anything you can't measure. You may not even know it's here. This gives us a way of measuring what's going on. We can see even subtle chemical changes, and we can see numerous disease processes. Okay? If you're talking about cancer or multiple sclerosis or arthritis, we want to detect disease.